State House leaders blasted the proposal as a slash and cut approach that kicks low-earning residents off their health care coverage so the savings can be used to enrich the wealthy with tax cuts. According to state health officials, the proposed congressional changes put a significant portion of Maryland's 1.5 million Medicaid recipients at risk of losing health care coverage.
These particular proposals are designed to make it harder for people to access healthcare coverage and to enroll into the program. What that means is people will lose their health insurance.
In their search for budget savings, congressional Republican leaders say they're proposing tightening Medicaid eligibility, installing work requirements, and ending the state's ability to tax healthcare providers to help pay the state's share of Medicaid costs. Maryland Democrats charge, however, the savings will make tax cuts possible for the wealthy.
It is a slash and cut approach that is really designed to take health care away from individuals. Why? In order to balance the budget to pay for tax credits.
According to state health officials, 56,000 adults could lose coverage by implementing work requirements. Increasing eligibility checks to every 6 months would kick 130,000 adults off Medicaid, not because they don't qualify, but rather because of increased red tape. The state also loses money if it can't leverage assessments on healthcare providers to help pay its share of Medicaid costs. 60% of Maryland's Medicaid commitment is covered by federal funds.
We are certainly concerned of the impact of what loss of healthcare coverage means. We know that that means that people don't have access to the care and services that they need. And that ultimately means that people don't have the tools that they need to be able to live long and healthier lives.
Medicaid services include hospital care, doctor's visits, prescription drugs, births, long-term nursing care, behavioral health, dental, and programs for the developmentally disabled.
They say these cuts will eliminate waste, fraud, and abuse, but they will really close hospitals, raise premiums for our most vulnerable communities, and increase uncompensated care.
State officials believe there's still time to lobby for a more reasonable approach, but if the changes stand, there is time to make adjustments. Some of the elements of the proposal don't take effect until 2027 and 2029. There are more than 500,000 Medicaid recipients in the greater Baltimore area alone. State health officials say the proposed changes create unnecessary and inefficient barriers to health care. Reporting live from the newsroom, David Collins, WBAL TV 11 News.